Okay, hi everyone. We will slowly get started just because we do have a lot of to cover, and we will just wait as other people join. So first of all, thank you everyone for joining us today. Before we get started and before I introduce our panelists, I just wanted to give you a little bit of an introduction. So in terms of who we are as the Lung Association, we are Canada's oldest charity, and our focus is lung health. So we've been doing that for 120 years. And we're really happy that we are able to bring you this webinar today. And just before, again, I introduce our wonderful panelists today, I do want to say that this is our first time using Zoom for a webinar. So do be patient, please, if there are any technical issues. But I trust that everybody can hear me and everything is going well. The other thing I wanted to just bring up is that we will not be able to speak to any possible progression of the coronavirus, nor will we be able to diagnose anybody on this webinar. And how we will do this is we have had an overwhelming number of responses, and we've had a number of really great questions submitted to us ahead of time. So what we will do is we will take the first 45 minutes or so to go through those questions, and then throughout this time, Sarah, who has already greeted you on our chat, she will be monitoring any comments that you will have in your chat, and we will open up the floor to those questions in the last 15 minutes of this webinar. And whatever questions we will not get to, because again, you know, there are over 900 participants on this webinar, so we may not be able to get to all of the questions, but we will be collecting all of them, and we will do our best to answer those questions after the webinar on our website. Likewise, the recording of this webinar will be available on lung.ca. So now I would like to introduce and thank our panelists today, who have generously given us their time and expertise today to answer your questions. So first we have Dr. Sean Aaron. And Dr. Sean Aaron is a respirologist at the Ottawa Hospital and a professor of medicine at University of Ottawa. And his research expertise is asthma and COPD. Dr. Aaron has his medical degree from McGill and trained in internal medicine and respiratory medicine and critical care at University of Toronto. And he is also the lead investigator and director of Canadian National Respiratory Research Network. So welcome, Dr. Aaron, and thank you so much. Next, we have Neal Johnson, and he is a registered respiratory therapist, and he received his diploma in respiratory therapy at Winnipeg Health Sciences Center. And then he went on to complete his Bachelor of Medical Rehabilitation and RT degree at the University of Manitoba. And he has extensive clinical teaching and management experience across the healthcare continuum. And right now he's also the Director of Health Initiatives and the President and CEO of the Lung Association in Manitoba. So welcome, Neal, and thank you for joining. Next, we have Dr. Irvin Mayers, and he is a professor of medicine and a former pulmonary divisional director at the University of Alberta. And provincially, Dr. Mayers is the medical advisor to Respiratory Benefits Program. He's also the chair of the Health Canada Scientific Advisory Committee on Allergy and Respiratory Therapeutics. And his interests include asthma and COPD, as well as sleep disorders. So welcome, Dr. Mayers, and thank you. And last but certainly not least, we have Dr. Erica Pence, and she's a respirologist at Royal University Hospital in Saskatoon and assistant professor in the College of Medicine at the University of Saskatchewan. And her research focuses on understanding burden of disease in patients with all types of lung diseases, including COPD, asthma, and lung cancer. And she has particular interest in smoking cessation and the interaction of vaping and smoking among youth. So thank you and welcome, Dr. Pence. Thanks to all of you for, again, giving us your time today. So this is the agenda of the topics and questions that we will go through. And again, please feel free to ask any questions you may have in the chat, but just know that we won't be getting to them right away. We will just leave it to the last 15 minutes. So now I will start with some of the questions that we have received. And so the first question will go to all of our panelists, and I'll just make sure that all of them are able to speak. There we go. Okay, so the first question: what does increased risk look like for those with chronic lung issues? And we've received this question a number of times. If each of you could speak to that, that would be wonderful. Maybe we'll start with Dr. Aaron, and then we will move westward.
Sorry, Marquetta, there was a lot of echo on that question. I'm not sure I actually heard it.
Okay, sorry about that. Let me try again. Okay. What does increased risk look like for those with chronic lung issues? So what does it mean when we say that those with lung diseases have increased risk of contracting COVID-19? What would that look like?
Okay, well, I don't think that people with lung disease have an increased risk of contacting COVID-19. They have the same risk of infection as everyone else. And of course, they can minimize that risk by self-isolating. The risk comes that if people with chronic lung disease do get infected with the virus, they are more at risk of bad outcomes. Specifically, they're more at risk of hospitalization and perhaps more at risk of needing the intensive care unit. And that's simply because COVID-19 is a virus that directly attacks the lungs. And people who already have pre-existing lung disease are simply going to be more at risk of doing poorly if they get infected.
Okay, thank you. Neal, I'm just moving westward now. Neal, is there something you would like to add to that?
Well, just that the issue with folks with the chronic lung disease already may be at increased mental health issues because they're more worried. So I would recommend that people living with chronic lung disease look for supports, make sure they have good family support or neighbors, that kind of thing, so that support network can help reduce that stress on you as an individual.
Okay, thank you. Dr. Pence, I'll move over to you.
I think I see risk the same way as Dr. Aaron, so I view it as, risk of potentially contracting the virus versus the risk of having a poor outcome once you do get the virus. And so I think that for people who are living with lung disease, I don't think it can be emphasized enough that actually preventing the contraction of the virus, so getting in contact with someone who's potentially sick, following the guidelines from public health around isolating and good hand hygiene and avoiding others who are sick are super important, because by prevention, then hopefully we can reduce the risk of a poor outcome, as Dr. Aaron had mentioned.
Thank you, Dr. Pence. And Dr. Mayers?
I think I'd agree again about the difference between the risk of getting an infection and then the risk of progressing to bad outcomes. The only thing I'd add about the bad outcomes is right now there's really no evidence that the medications that are used for most of the illnesses, the severe lung disease, that there's really nothing that says these medications might set you up for worse disease or for better. So I think it's important that whatever regimen people are on, they continue on that and they don't worry about suddenly stopping things that have been keeping them otherwise healthy.
Okay, thank you. Thank you, everyone. The second question I'd like to ask everybody, it really builds up on this. So we have already spoken about the measures that are in place for all Canadians in terms of social distancing and hand washing and those types of behaviors. But for somebody living with lung disease, for instance, asthma or COPD, are there additional measures that they should take or precautions or different behaviors that they should have in addition to those to really protect themselves? And maybe we'll go now again from Ottawa over to the west, just so we have the same order here. Dr. Aaron?
Sure. I think that the important thing to remember is that the same things that protect the general population are going to be the things that protect people with lung disease. So what you need to do to reduce your risk is try to self-isolate and not put yourself in the position where you contact other members of your community who may have the virus. You should only be in contact with the people you're currently sharing a home with. Otherwise, you should be trying to go out as little as possible. If you do go out, try to stay at least 2 meters away from other people. If you have to go to the grocery store, bring some wipes and make sure you wipe down the grocery cart handle. Make sure you bring Purell with you so that you can clean your hands often, and try not to touch your face. These are all the things that everybody is being told to do, whether you have lung disease or heart disease or kidney disease or no disease. And I think everyone, if we all follow the same rules and the same advice, we'll stay safe.
Okay, thank you, Dr. Aaron. Neal, would you like to add anything or build on that?
Not specifically on additional measures to protect the lungs, but I would say that people with, for example, asthma and COPD, you should have an action plan. So make sure that you review it and you review it with your caregivers so that everybody understands what to expect if you have a flare-up. And then one of the big differences between COVID and other your chronic lung disease is the presence of fever. So you should be aware of the role of fever in all of this.
Okay, thank you. And we will also get more into the specific of this as we go down the list of the questions. I'll move over to Dr. Pence.
Yeah, I think actually I would highlight what Neal has said. So I think an action plan is actually really important, particularly during this time with COVID-19, so that people do feel like they have some support in place to escalate their therapy if they develop symptoms, and or a way to communicate back to their clinician around how they're doing if they're developing new symptoms or worsening. So certainly an action plan is I think really important for particularly our asthma and COPD patients. I also think that probably this is another time to just emphasize that taking the prescribed therapy that you've agreed to do with your doctor is again just probably this is the most important time to be sticking to your good maintenance regimen. If you have asthma and are on an inhaled steroid, that you continue with that every day, and so sort of following just your general treatment plan to keep yourself well and your symptoms in control is also super important.
Wonderful. Thank you, Dr. Pence. And Dr. Mayers?
Yeah, I just echo, especially what Dr. Aaron was saying, that we should be, all of us, doing the same good public health measures. And people with lung disease should do exactly those same good public health measures.
Okay, wonderful. Thank you. Thank you, everyone. I would like to now move over to some disease-specific questions that we have received. So I'll start with Dr. Aaron, and the one question that we received was whether it is still safe to go to your doctor's appointments, and whether people should keep their asthma clinic appointments or whether they should reschedule.
Well, thanks, Marquetta. What we've done at the Ottawa Hospital now is we've tried to move all of our clinics, our outpatient appointments, to telephone visits instead. So we're trying to keep people at home, self-isolated, and we're phoning them and doing the appointment by telephone. I think that's the safest way to see a patient with asthma or COPD right now. Now, the only exception to that is if somebody with asthma or COPD feels acutely ill. If you feel that you're getting acutely ill and sick with your breathing, then that's the time, obviously, to come to the emergency room. But if you're not acutely ill, the best place for you is at home.
Okay. Okay. And would that be the same for other doctor's appointments then? Would you recommend that as well?
Well, for just about all doctor's appointments, unless there's something urgent that must be seen in person. And you know, I can't comment on other doctors, but for us, we're the only people we're seeing urgently in person at the Ottawa Hospital right now are people who call and tell us they're acutely ill and must be seen. And most of these people we're trying to see actually through the emergency department, because we don't want them walking through the hospital and potentially giving other people in the hospital COVID.
Okay, wonderful. Thank you. Are there any other experiences that anybody else has in different provinces? Neal, do you know whether all asthma clinic appointments are also postponed in Manitoba, or do you know what?
I don't think, yeah, the guidance is to, if you have a regular appointment, still try and keep it. But if you have a chronic disease, you need to have it managed. Because if you let it go, then the additional care that you may require will put additional burden on the healthcare system. So the important part is to stay healthy. In Manitoba, many primary care physician clinics and other services are going to online and video. So I would say call ahead and go over that with your practitioner.
Okay, so again, remote management would be the best way, and that's what's being done in Manitoba as well. That's great. Saskatchewan, Dr. Pence, what are the rules at your hospital or elsewhere in Saskatchewan?
Yeah, so we've implemented the same protocol that Dr. Aaron has mentioned. So we have basically moved all of our appointments to routine ones to telephone and or video where possible. And we are only bringing in urgents at the moment. I also know that in our family practice, clinicians are also trying to triage and deal with most issues, if they can, by phone to limit the traffic volume through their clinics. And basically, it's just trying to prevent potential spread of the virus out in the community.
Okay. So basically, right now, what I'm understanding is keep your appointments, but do them by phone or virtually, however is offered by your clinic. Okay. And is anything different in Alberta or in Edmonton, Dr. Mayers?
In Edmonton, well, Alberta Health Services is just activating visits by Zoom. If I can make Zoom work, that's how I'm going to be using that technology. But my outpatient clinics now are telephone clinics. There are some opportunities for telehealth clinics, so more formal computer links, but that makes the patients go to a telehealth site which may be attached to a hospital. So we're actually limiting that unless absolutely necessary. And on the whole, I think more and more physicians, as we're using telephones, are recognizing that some of the routine visits when people are well just need sort of a touch and a contact to make sure things are staying in a good direction. Eventually, face-to-face visits, would be helpful, but at this moment, no.
Okay, that's wonderful. It's great to hear that there's the same messaging going across the board there. The next question I would like to ask is, again, I'll start with Dr. Aaron. How can the virus impact people with asthma or COPD? And we've already touched on that it might have more severe outcomes, but can you speak a little more to what that might mean for people with asthma? Or
Yeah, I mean, thanks, Marquette. I think the first thing is everybody has stressed thus far is people with asthma or COPD can protect themselves by taking their medication, their usual medications as prescribed. If you do get this virus, you want your lung function to be as good as it possibly can before you get the virus. So the way to optimize your lung function is take your medications as prescribed by your physician. It's not the time now to cut back on your baseline medications. And if you're on an inhaled steroid or another type of puffer, make sure you take it regularly as prescribed. Now to answer your question, we don't know a ton about what happens to patients with asthma and COPD when they get coronavirus. There haven't been many studies really published at this point yet. We think that it may, that getting the infection with coronavirus may worsen your underlying asthma or COPD, may worsen your airflow obstruction because there will be more inflammation within the bronchial tubes as a result of having the virus. So your underlying condition potentially could worsen. And then if you get pneumonia from the virus on top of that, things could get even worse. So that's about all we know now. We know about 15% of patients who get admitted to hospital with coronavirus in other countries have a history of chronic lung disease. And so clearly chronic lung disease is a bit of a risk factor for admission to hospital. The best way to avoid this is to avoid the virus. Stay inside, take precautions, and don't get sick to begin with.
thank you. Thank you. Is there anything else anybody would like to add to what Dr. Aaron said? No? Okay, we'll move to the next question. This one's a bit longer, and I will start with Dr. Mayers. So should people who have a lung disease go directly to the hospital because of underlying conditions if they experience COVID-19 symptoms? The other side of that question is some people are concerned about going to the hospital in case they expose themselves to COVID-19 and they already have underlying conditions. So it's a two-sided question. So what advice can you give to people about how they should seek help or what they should do?
Yeah, I mean, this is not a straightforward question, you know, and it is complicated. Everyone's worried, you know, people with or without lung disease have a lot of concerns about getting this infection. One of the things to recognize is that in all the publications that have come out of Asia, this disease doesn't progress over hours, it's over days. And usually the sort of range of progression is about 1 to 4 days in the people who needed hospitalization. So from symptom onset to the day of hospitalization, it's between 1 to 4 days. So there's time to see how you're doing. Rushing to hospital right away, if everyone with lung disease does this, emergency rooms will be overflowing. There's people with lung conditions often have transient ups and downs. If you start feeling a bit unwell, activate your action plan. If you're getting worse and you're getting more short of breath or your fever is spiking and you're feeling, you know, very unwell, so that I know that's relatively non-objective. But if things are progressing or you're getting progressively more short of breath, that's the time to be thinking about emergency. There's some jurisdictions that have good phone lines activated. I'm not sure about other provinces. Alberta has HealthLink. You can get some advice over that. It may take a while to get an answer. So if you're getting worse and you're more short of breath and you're worried, that's the time to be seeking emergency room help. The flip side, can you get sick in emergency rooms? That's always been true. That hospitals are where people with viruses end up, and there are risks. That there's good triage going on to try and divert people from cohorting, from being stuck together with everyone who has symptoms of an acute lung infection. But if you're showing up with symptoms of an acute lung infection, you will be put into that cohort of people to be assessed who may have COVID. But if
Okay.
you're really ill, don't hold off. You should get seen.
Okay, so basically the steps would be monitor your symptoms, stick with your existing plan of medication, and if you see your symptoms worsen, first seek help through the provincial helplines and health authorities. But if your symptoms get severe, that's when you should go
Yes.
the emergency. Okay. Are there other behaviors or other thoughts that anybody else would like to add? No? Okay, I will move on to Dr. Pence with the next question. Question is coming from somebody who is in remission with lung cancer. And should those who currently have lung cancer or are in remission be doing something differently other than following social distancing measures and everything that everybody has already spoken to? Is there something else because of the affected immunity or anything like that that you would speak to?
So yeah, I think this is a great question, and I think it because I think it can apply to those who are living after being treated for lung cancer, and it can also apply to other individuals who might be living with conditions that may be impacting their immune system. So I think what we've been talking about is the coronavirus is a virus that's highly transmissible, and it's spread, through droplets, okay, that we encounter from someone who is infected with that virus. And so that means that it is spread through direct contact with someone who either might cough or sneeze in your vicinity, or where we might actually touch a surface where that virus has, landed on. And we know that the virus can live on different surfaces for a number of hours. So I think for those reasons, number one, the concept of social distancing becomes really important because of how we understand the virus's spread through droplets. And so maintaining that distance is important. For people who may have concerns about their immune system or have underlying lung disease that may make them more vulnerable if they did get the virus, I think that's where, in addition, hand washing, it sounds like it's such a simple concept, but it truly is so important in this case. So making sure that if you suspect you've been in an area there where you could have contacted it, or just in general is routine hand washing and avoiding your hands on the faces. So because you want to prevent that spread. So really, short answer for individuals living with lung cancer or even those under treatment, nothing special than what's been recommended, but only to emphasize that some of these simple measures are vital.
Okay, thank you. Does anybody else have anything to add to Dr. Pence's comments? No? Okay, the next question, again, I will start with Dr. Pence. How important is it for people living with lung disease to get the pneumonia or influenza vaccine? And will it offer additional protection? And the secondary question is, what about a booster? If a person was asking if they can not get the booster now, what does that mean? Does that mean they're more likely to get COVID-19 or more susceptible to get a severe case of it if they do? If you could speak to those vaccines and the boosters, that would be.
You bet. Okay, thanks, Nikita. So the vaccine for pneumonia is for a specific bacteria called streptococcal pneumonia, or we call it pneumococcal pneumonia. So this is a bacteria that's responsible for causing pneumonia, but it's not the only bacteria that causes pneumonia in the community. It just happens to be the most common cause of bacterial pneumonia in the community. So that's why a vaccine is really important for this particular bacteria. Also, the flu vaccine, as you know, this protects against an influenza virus that is basically aimed at the most common virus causing illness in this upcoming season. So from this last year, the virus was aimed at those strains identified in 2019. So covering influenza A and B. So vaccines for people with lung disease are super important because we know that people with COPD particularly and lung disease are higher risk for pneumonia than those who don't have COPD, and the benefits from vaccinations are even greater in those who are over the age of 65. What's really important for people to know is that when we get sick with either the flu or with pneumonia, it causes extra inflammation in our lungs, our airways. It can cause extra mucus to develop. And because of that, we can get more symptomatic from our baseline. And sometimes that can be so much so that it actually might affect our lungs' ability to deliver oxygen to the rest of our body. And that's what might bring people into hospital or even into the intensive care units. They get very sick from this inflammatory response. We know that the pneumonia vaccine and the flu vaccine don't offer any specific protection against the coronavirus that we see. But we do know that for those who have been infected with coronavirus, sometimes they get what we call super infected. They can be co-infected with influenza, or they could develop a bacterial pneumonia, and one could be strep pneumo. So there are benefits to having these vaccines on board because they may be able to offer someone protection for those cases when they may be at risk of developing either the flu or a bacterial pneumonia in the setting of them having COVID-19. The other question is if you can't get the vaccine now, you can't get a booster, for instance, for pneumonia, is it more likely that you're higher risk for COVID-19? And I think the short answer for that is no. I don't think so. I think that you're at no increased risk necessarily of the virus itself.
Okay, wonderful. Thank you. Does anybody else have anything else to add to Dr. Erica Pence there?
Yeah, Marquetta, I just wanted to add, I thought that Dr. Pence answered the question excellently, but I'm going to just tell people right now that, believe it or not, I've never said this in my life, but now is not the time to go to your doctor looking for vaccine. There's no vaccine for coronavirus. And if you go out in the community and try to get a vaccine for influenza or pneumococcus right now, you're probably more at risk for getting coronavirus by being out in the community. So I would say don't worry about getting vaccines. If you've had them already, that's great. But if you haven't had them, it's not an issue right now. Don't go looking for a vaccine. Don't go to your pharmacy or your doctor looking for vaccines. They're not going to help right now.
Okay, thank you. Thank you for the clarification. So absolutely. So if those with lung disease who already have pneumonia or influenza vaccine, that's great, but don't go out of your way to put yourself at risk to get it, if I understand both of you correctly then. Wonderful, thank you. So the next set of questions sort of deal with behavior, and especially behavior when we're in our homes. So I will start with Neal Johnson. What can caregivers or frontline staff who have lung disease do to protect themselves? And then the flip side of it, what can healthy caregivers for those who have lung disease do to protect the patients? So in both cases, we're asking about caregivers, but on one side, it's the caregiver who actually has, specifically, this was coming from somebody who has asthma and another person who has COPD, but they're a caregiver for someone. Mm-hmm. So what can they do? And then the flip side of that, again, if you are a caregiver, but you're a caregiver for someone who has asthma or COPD, what are some protective measures?
So surprisingly, there's no special steps to take other than the recommendations of hand washing, social isolation, or distance, physical distance, sorry, and taking the usual steps. Now, I happen to have the advantage, my wife is an HR professional for a health organization, so I asked her about if a staff member has a lung disease, what do they do? And so they should talk to their doctor, and they may have to get dispensation from their physician to not work, because that adds increased potential for exposure and they're high risk. So that's a conversation for the staff member and their physician to have and then they have to talk that over with their employer. Employers will have occupational health departments that will answer those questions. So basically the same kind of steps you would take in any situation with dealing with the protection from the virus. Now, what healthy caregivers can do to protect the patients? Well, again, hand washing, distance when you go out, those kind of things, but also help with the person with lung disease with their healthy living. They're going to need to maintain nutrition, particularly maybe difficult if they can't get groceries regularly, so you need to focus on nutrition. Need to continue exercise, and again, it may be limited because you're used to going to the gym, but now what do you do at home? So you should look at a program that continues the exercise at the home, in home. And then the third thing is socialization. That's still important. So you have to think of ways of how to maintain socialization and interaction from a human perspective. Those are all important.
But by interaction, just so we're clear, we mean more so, call a loved one or connect remotely, right?
Yeah. So if you're in the same household, then that you do need to do some things together.
Sure.
But if you're looking after a parent, for example, then staying connected, helping them set up on social media, those kind of things are very important. There's Facebook groups and things like that can continue even if there's physical distance situations going on.
Okay, that's great. Is there anything else that anyone would like to add? No? Okay, so the next question kind of builds up on that. So this came actually from a number of parents of children who have asthma, and I'm going to start with Dr. Aaron. And they were asking what they should be doing to protect their children because they have to go to work. So they're not able to stay at home. They're not able to be isolated with their children. Is there anything else they can do to protect their kids?
Well, firstly, most importantly, keep your child on their asthma medication. Don't skimp on their medication. Don't stop medication during this crisis. That'll protect them the best. The other thing they could do clearly when they are at work is to try to practice safe public health maneuvers. In other words, try not to mingle closely with coworkers, keep 2-meter distance, etc. Wash your hands often. When you do come home at the end of the day, it's a good idea, before you see your child, I would probably suggest taking your work clothes off, washing your hands, and even if you can, get in the shower and take a quick shower, and then dress in new clothes, and then hug your child. Those are probably the best ways you can protect your kid with asthma.
Thank you so much. Is there anything else anybody would like to add? I'm a bit conscious of time, so I'm not trying to rush, but I am conscious of the time, so we get to as many questions as we can. So the next question, Neal, we have a lot of questions around the use of face masks. Mm-hmm. When are they useful? When are they helpful? When should people wear them and who should wear them? Mm-hmm. Can you speak to that?
So to keep it brief, people who should wear a mask are in situations where they're told to wear a mask by authorities, and it could be the work authorities, it could be in a medical clinic, the receptionist hands you a mask. So you'll be told to wear a mask if you need to wear a mask. Health Canada does not recommend wearing a mask in the community. It doesn't provide additional benefit, and there may be additional risk because you have a false sense of security. It's important, like if you have chronic lung disease, which involves, if you're having cough, then that, that's, if you're going out in public and you're coughing, that's going to, they may raise some eyebrows in the people around you. So cough etiquette is very important. And again, one of the reasons we don't recommend wearing a mask all the time out in public is that if you think of the mask as a Kleenex, how many times do you reuse a Kleenex? You don't. You use it once and throw it out. And a mask is very much like the same thing. If you happen to cough into the mask, then it stops becoming effective. If you get if you become overconfident and you reduce the distance, the physical distance between you and somebody with the virus, and you walk through their aerosol cloud, you may get the virus on your mask. And then what do? You touch your mask, you touch your eyes, it's itchy. Masks themselves, the paper ones, generally only work for about an hour because your exhaled breath will make them wet. So for all those reasons, basically, we don't recommend wearing a mask in public. Basically, if you're told to wear a mask by a health professional, that's when you wear the mask. If you're going into hospital or if you're or clinic, that kind of thing, and if you have cough. But other than that, we don't generally recommend. There's a lot of different types of masks. They have to be fit properly. It's just better to keep your physical distance. You're 6 feet 2 meters, and cough etiquette, hand washing, very important.
Okay, thank you. Any other comments to that topic from anybody? No? Okay. The next question, I will combine the two because they both have to do with health and behavior at home. So one, how can we make sure that the air we have in our homes is actually good and clean now that we're spending so much time at home? And the other question is, are there breathing exercises that people can be doing to strengthen the lungs just so they're best prepared to handle whatever situation might arise? Neal, if you could speak to those two.
Yeah, so basically you want to look at anything that you do that could decrease the air quality in your home. So we don't recommend burning candles, incense, smoking. Even if you have a smoker in your household and they go outside to smoke, the smoke will stick on their clothes, and you bring that in, you get secondhand smoke, you get third hand. It's just we recommend people stop smoking, and vaping is sort of falling into that basket now too. So if you have a forced air furnace, change your air filter, make sure it's fresh. Keep an eye on what scented products you're using. So perfumes, hygiene, deodorants, hairspray, they can also decrease the air quality. And cleaning products. There's a lot of scented cleaning products. So they can cause sensitivity. So, be aware of how many scented products you're going to be using. And then the other thing is we're going to be disinfecting a lot of surfaces. We're probably going to be using bleach a lot more than we're used to. So make sure you read the label, because if you mix bleach and, for example, ammonia or toilet bowl cleaners, it causes toxic gas to be formed, and that will be, it will affect healthy lungs, and it will affect people with lungs even more. So read the labels, certainly use bleach, but follow the labels. It's something we have to be very careful of. You can't mix your bleach and your window cleaner to have a super cleaner. It could be super deadly. And then finally, some people ask questions about, should I have a room air filter, like a HEPA filter? It's the evidence is kind of mixed. HEPA filters for a room air purifier can reduce dusts and things 30 to 50%, but you have to make sure that they're maintained, they're cleaned properly according to the manufacturer's directions. And those are kind of simple things. Keep the humidity in your home under control. You want to watch for condensation building up on your windows that will reduce mold and mildew. And then dust, your regular housekeeping, sweep and vacuum and dust, and keep the regular dust down. And I think I think those are the main things. If you are looking at an air purifier, avoid the ones that produce ozone, because ozone can be a lung irritant as well. Look for the HEPA filter and then maintain those appropriately.
Okay, thank you, Neal. And as far as breathing exercises?
Yeah, so exercise is good for everybody at every stage of life. So we recommend it: cardio, strength, and flexibility. It will help with your cardiovascular efficiency. It's good for your mood, and it passes the time. And so it won't necessarily strengthen your lungs per se, but it will give you a lot of extra physical and emotional capacity to be able to do your activities of daily living. And all stages of people living with lung disease can benefit from exercise. So we highly recommend it. And there's some good online programs that you can look up for at-home exercises with just things you have around the house, like soup cans for weights and just standing up and sitting down on your chair, those kind of things. And they generally, cardiovascular exercise generally doesn't increase your lung capacity, but just makes you more efficient at using oxygen. And so you'll be healthier and be able to accomplish your daily activities better with less breathing stress.
Okay, thank you so much. I will move, I will save a couple of the questions for the FAQ document we will develop after this. But a number of questions we received were specifically in regards to the types of emergency prescriptions or medical equipment that people should make sure that they have. For example, oxygen, inhalers, ventilator. So I will start with Dr. Mayers, and other questions in relation to this was if there is anything that people need to know about sterilizing equipment and pickup versus delivery. What would you recommend in terms of keeping as many supplies as you need and being really prepared for this?
So very briefly, whatever medications you're currently on, stay on. If you're on inhalers, stay on them. If you've been prescribed home oxygen, stay on that. Don't buy oxygen concentrators if you haven't been prescribed oxygen. People who get severe lung disease from COVID that need oxygen need to be in hospital, that they can deteriorate very quickly. So then the sterilization is straightforward. You shouldn't have all that stuff at home. You know, just what you've been prescribed. There's nothing magical about oxygen therapy. Ventilators, again, that's a hospital-based treatment. So don't even worry about that.
Okay, all right, thank you. That was very straightforward. All right. The next question is also for you. So we had a number of questions around alternative types of therapy. So if people have trouble accessing medical supplies, are there any home remedies that they should try? For example, people have asked about the use of hot steam, humidifiers to breathe, chicken soup, foods like garlic for inflammation, vitamins and supplements. What are your thoughts on that? I'll start with Dr. Mayers again.
So again, yeah, the short answer is there's no data. I'd be careful with steam. You can hurt yourself, you can burn yourself. Things like chicken soup have actually been investigated years back for colds. And warm aromatic liquids make you feel better. If you feel better with it, use it, but it's symptomatic. But again, be careful with some of these high dose supplements. You don't always know what they are and what's in them, and they may actually interact with the medications that you're currently using. For vitamins and supplements, for most of us, if you're keeping a normal, healthy diet, you have enough of all of these.
Oh, I think we might have momentarily lost Dr.
May not be
Okay.
benefit for you.
Okay, thank you.
If I could add to that, the only, and it'd be interesting to hear from the respirologist, for asthmatics, if people can't you get access to their Ventolin or their reliever inhaler, we have heard about strong coffee, caffeine being have some bronchodilator effect. Any comment on that?
Well, I think ideally, Neal, we would want people to use their medications. Coffee does have the caffeine does have a bit of a bronchodilating effect. There's no question about that. It works a bit like Ventolin, so it's not going to hurt you. But I would always reach for your actual medication rather than over-the-counter remedies.
Okay, and actually the next question sort of builds up on that. So a lot of people were confused about the use of steroid medications with COVID-19. So what can you tell us in terms of that? And then to build on that, we've also received a lot of questions around the use of prednisone during this time. So Dr. Aaron, can you speak a little bit about that, about the use of steroid medications and inhalers, and then as well as prednisone?
Yeah, well, thank you. If you were prescribed a steroid inhaler, an inhaled steroid for your asthma or your COPD or your lung disease, you should definitely continue to use it. If you have an action plan and you're having an acute crisis of your lung disease and you have to go to your action plan and your action plan includes prednisone, you should take it. But there is no evidence that prednisone itself helps to treat COVID infection. So the only time you should be using the prednisone is if you have an action plan and your physician has prescribed it for an acute deterioration. But don't start taking prednisone in an effect to try to prevent or fix COVID. It will not work. It's to treat your asthma or your COPD, not to treat COVID.
Okay, thank you. Are there any other comments on that?
No, Marquita, I wouldn't add anything to what Dr. Aaron has said, but just to maybe note that there's some feedback in the line, so I'm not sure on the phone call, so whether or not.
Yeah, I will. Where that's coming from.
I suspect it's coming from Dr. Meyer's line.
Is it better now?
Yeah.
Yes.
Okay. So I will ask a last question before we open it up to the chat questions. And so I will ask you, Dr. Pence, do we know the long-term effects of COVID-19, and does it damage your lungs? Could it be worse for those who already have lung disease? What can we say, or what do we know?
So I think that the brief answer to this is that it is still probably too early to say for sure, to know what the long-term impacts are, particularly for those living with lung disease. One thing to keep in mind is the COVID-19 virus is primarily a respiratory virus. So that's where it targets and where much of the injury occurs is in the lungs. And anytime a virus invades our lungs, it basically activates our immune system. And the immune system gets busy and tries to contain and kill that virus. But it also kind of activates all the other troops, all the other cells, immune cells in the body. And those immune cells create inflammation. And basically that inflammation, yes, can sometimes have a good impact on the virus and keep it at bay, but it can also damage some of the normal cells in our lungs and airways. So for those living with lung disease, that the risk is that there would be further damage to the lungs with an infection with COVID-19. And what we do know that when we have something like inflammation in our bodies and when we're repairing after an injury, we can develop scars. And sort of you can think about that even in the setting of people with lung disease, that we may not be able to reverse some of the damage that occurs from this virus for those who already have underlying lung disease. So unfortunately, we just don't know to what extent that will have an impact, you know, at an individual and also at a population level, but it's something that we'll be certainly following with great interest.
Okay, thank you so much. Thank you, everyone. I will now pass it over to Sarah, who has been tracking the questions in the chat. We have about 6 minutes, so apologies again, but we'll go through all these questions. This has been a great discussion. Just after this, you will receive an email with a survey, as well as a list of resources in each province and online that you can access for help. So you will be receiving all of that by email, and this recorded webinar will be posted on our website as well. So with that, I will pass it over to Sarah.
Thanks, Marquita, and thanks to everyone who has passed in questions. We will try to follow up to make sure that you get the answers that you're looking for. There have been a number of questions that have come up on the chat that I think have been addressed around medication use, action plans, mask use, etc. So I think we've covered off many of the ones that have been asked. Jumping to one of the other questions that folks have, we heard earlier around not going to unnecessary appointments. What about for folks who might need regular blood work, maybe getting regular blood transfusions or have ongoing ultrasounds, et cetera, appointments that they may not be able to miss? What do they do in those situations, and how can they best protect themselves? And I'll let anyone on can kind of jump in as they may have an answer.
Okay, well, I think, Sarah, if you have a regular appointment and it's something that you cannot miss, then you need to go, but you need to be aware that you have to maintain social physical distance from the other people who come. You should bring your hand sanitizer with you and sanitize your hands frequently. And as soon as your appointment is finished, you should head back home.
Okay.
And if I could add to Dr. Aaron's comment, I do wonder whether in some jurisdictions where, for instance, people may be receiving regular blood transfusions, for example, a lot of these units do know, for instance, in the setting of this COVID-19 crisis, that the importance of social distancing, and many places have been implementing timed appointments so as to minimize the traffic through their unit. So certainly as a patient who, for instance, you have to go regularly to that location, it's worth asking in advance, you know, how are you limiting traffic in this area in order for me to protect my health?
Okay, thanks so much. Sounds like continue to follow the guidelines, try to make your visits brief, and maybe follow up to find out if there's a different way, a different timed opportunity for you to take that visit. A couple of questions have been around specifically individuals who suffer from a suppressed immune system, and looking to, one person mentioned in particular some cases of double lung transplant individuals in Germany, and wondering about, again, how they can, are there additional measures that folks who are immunocompromised can take, and what specifically they should be doing to best protect themselves?
You know, Sarah, I think that anybody who has any chronic disease, whether it's chronic kidney disease or heart disease or lung disease or a lung transplant, they have to just be taking the general precautions that we've gone on about today already. There is nothing extra you can do or that you should do above what all of us should be doing at this point.
Great. Okay. Some folks are asking, we've seen certainly in the news lately some talk about malaria medication having some possible uses for lung issues. Can anyone speak to those types of drugs that have been referenced most recently and their impact on COVID and lung function?
Gosh, I'll take a stab at that. I think in short, certainly there has been reports of the use, and in some cases, in some individuals, positive responses to these medications. I think what's important to keep in mind is that these are observations that we're seeing as this infection and pandemic unfolds. And the challenge that happens when we observe behaviors or responses or outcomes from, for instance, a treatment, it doesn't necessarily always apply to everybody. It may have worked in that one individual case and doesn't necessarily apply broadly. And I think that it's too early to know the evidence for the use of these medications right now in COVID-19 patients. And unfortunately, you know, there has also been some reports of people getting access to these medications and then having overdose or toxicity from them. So I would say that right now, our current practice is that we don't use these routinely. But but definitely there are studies undergoing to try and figure out what are the best and most effective and safest medications we can use.
Great. Thank you, Dr. Pence, for that. Maybe I'll go to the group here, and I know, Neal, you had mentioned this earlier on, the challenge around mental health and anxiety, and certainly for folks who are suffering with lung disease, there is an anxiety around shortness of breath and that type of thing. Are there any tips that folks could offer to people who may be feeling increased stress or anxiety, depression around the being scared about both contracting COVID-19 and the severity that goes with it? Maybe Neal, I'll start with you.
Yeah, so certainly if people are experiencing increased symptoms of mental health concerns, they should seek help. It's very normal. For people with COPD, for example, there are some resources on lung.ca for dealing with how to get yourself out of a breathing crisis, to how to calm down, how to slow your breathing down. But for other lung diseases, it's the general mental health approaches to seeking ways of healthy coping with the stress. I know in Manitoba they've just announced an enhanced mental health access to psychological services. So in your province, seek out those services. If you're an employee and you have a Blue Cross or employee assistance plan, they often have counseling. Seek those out. Certainly it's normal to have high anxiety in these times. So the trick is finding healthy ways to deal and cope with that. And calm, reflective breathing, and try and avoid news 24/7. And those kind of things, but look for help, ask for help, and be open to receive it.
Great. Marquita, maybe I'll throw it over to you to see if there's any kind of final comments or thoughts from any of our panelists before we close out, and just to give an update again for folks around how we'll follow up with the many questions that I know people have that we do want to make sure get answered.
Okay, thank you, Sarah. And I know we're just past 5, so I want to be respectful of everybody's time. But I wanted to once again thank you to all of our panelists for joining us today and for giving us their time and expertise. Once again, we will be posting this online, and we will be sorting through all of the questions in the chat, as well as the emails that I have received prior to this, and we will do our best to answer your questions that you have asked. But I would really appreciate it, we all would, if you would take 5 minutes once you receive the follow-up email and answer the survey that you will be provided with. And so with that, do any of our panelists have any closing comments?
No, I wish everyone stays safe and healthy.
Thank you, Dr.
I would
Wash
echo
those
that.
hands. Good hand washing.
And thank you to the Lung Association for putting this together for our patients across the country. Yeah, it's been a privilege to be here. I have noticed that, and I certainly noticed in my own talking that we often reference much of the more common lung diseases like asthma and COPD, but many patients or individuals on the panel have mentioned things like pulmonary fibrosis or diseases of the lungs, scarring of the lungs, and all of the things that we've discussed about asthma and COPD would also likewise apply to patients living with pulmonary fibrosis as well, in case that helps people listening to the webinar.
Thank you so much. Dr. Mayers, any closing comments? I don't know.
I saw a few comments around things like vaping and smoking, and cigarette smoke is a danger with COVID. Vaping is unknown, but it's a danger in general. If you're a smoker, there are helplines. This is a good opportunity to quit and to keep yourself healthy in general.
Okay, wonderful. Thank you again to everyone, and I hope everybody has a pleasant weekend. Thank you, everyone.
Thank
Bye.
you.
Thank
Bye-bye.
Bye.
Bye.